I'm Anji Mehta. I work as Finance and Impact Manager for the NIHR School for Social Care Research. I'm just going to talk a bit about, and please don't take any pictures, I'm just going to talk a bit about research impact assessment, as it's something that we've had to, not had to, but we've been interested in and then have had to look at. So I'm just going to talk a bit about the background of where we've come from, just a couple of examples of how impact can be measured and what we've done so far and what we've learned, and then open to comments. So I wasn't going to define impact because everyone's been talking about it, but this is how we've used the Higher Education Funding Council for England's definition for impact, which is on the slides and it'll be available, but it's just essentially any effect and change and benefit to economy, society, culture, various other things. So our first question, the School for Social Care Research was set up in May 2009, and we are a commissioning body, so we have 15 million to commission research. And the first question, when we started looking at impact, and we did a few training courses with researchers, was to them, why are you doing research? What interests you, and what are you trying to achieve? Maybe I could just throw that out there. Why does anyone want to pitch in with why they're doing the research they're doing? Yeah.
To make a difference to people using long-term care services.
Okay.
To improve knowledge in social care.
Okay. Anyone disagree? Anyone have any other reasons for doing it?
I think it's fun.
Good. Sorry?
Self-education as well.
Okay, cool. So we've asked a few researchers now, and we've had similar responses: to make a difference, to help improve services, to find out what works and doesn't. I think there was only ever 2 people that said to me that they were aiming for promotion and that's why they're doing research. And one said they were doing it to pay their bills, which, fair enough.
It helps.
That's good.
Facilitate that one.
So then it begs the question, depending on why you're doing research, then if you're doing it to make a difference, how do you know you're making a difference? And that's where sort of impact assessment comes in, to be able to go back and check on the impact that your research has made for yourself, or to make a case as part of funding proposals to others, or for your own track record, or just because you're interested, like me, to know if it makes a difference. So for the School for Social Care, sorry, 1 second. So Round Europe is a group that we're working with, and they have looked at impact assessment a lot, and why people do research and what research should produce and the kind of outcomes from research. And they've listed some there. I've listed some from their work. So producing knowledge, increasing capacity for research, informing policy, improving quality of life, and sort of wider economic benefits, which also includes things like keeping researchers in jobs and that sort of thing. So for us, as the School for Social Care Research, why are we assessing impact? So up in the corner we have the School for Social Care Research. We've just decided that the director represents the school, and that's what we're going to have on every dinner. Well, it is to someone. So we have we have had 5 years of funding, and we've just started another 5 years. And in the first 5 years, we've commissioned 56 research studies, spent £13.5 million on those. 192 research fellows have been engaged in those research projects, and we have had extensive user, carer, practitioner involvement. Of those, all of those projects have to produce research findings and journal papers and do various other knowledge exchange approaches. But for us, we're not quite sure how we know that then translates to the sort of older person in their care home or in their home, and what impact that has. And for us, the School for Social Care Research, we do want to go through this process, but we also want to go straight and see what impact we're having. And our mission is to improve the evidence base, but to improve the evidence base so as to improve adult social care practice in England. So we're exploring impact partly as advocacy. I mean, we want to be able to make the case for research in social care and to say by doing research in social care it is having an impact, it is making a difference, and more funding should be spent on it, obviously. And also to practitioners, policymakers, decision makers, that the research that's being produced is important, does have a message, is going to change practice, and they should be looking to the evidence before they make their decisions. Of course, as with all of you, we have our projects are funded by we're funded by another funder, and a lot of our other studies are funded by different funders, and we have a responsibility to them to tell them what sort of impact their funding has had, and also to the taxpayers. I mean, that's where the funding originates from. And we're also keen to understand what does work, and going back to knowledge exchange activities, what kind of activities you could put in place that would improve or help support impact, and which perhaps don't work or don't work in certain ways. And also, as a research funder, for us it's useful to know what does work and doesn't work, so we know what we can and should fund or should not be funding, or should not risk funding. There are various methods for assessing impact, and those are some of them. We're through the School for Social Care Research, we are trying a number of these, but we're sort of very early on in trying a number of these, so I haven't gone into all of them. There is a paper that we're working on, so there will be more detail on each of these and how they apply to long-term care and social care towards the end of the year. But I'm just going to focus on two. One is economic returns analysis, and one is bibliometrics. We've worked with around Europe, and they have done a bibliometric analysis for us of adult social care research, partly to see what the current landscape is and partly to see if it works and the method works. So they looked at outputs from 1996 to 2011 and used Web of Science and Scopus. There was a three-phased approach, and through that they identified that many papers. So the three-phase approach included looking at the School for Social Care Research, the partners within it, and just having a look at their papers. They then had put together a very long list of keywords and key terms, 240 I think it was, which we then refined. And then phase 3 was to go back and look at citation analysis as part of that.
Just English literature?
No, they looked into anything in English language, but not international.
Just English and language?
Yes, anything translated to English.
I'm sorry.
But we were testing out, so maybe if we did further, we could go further. So this table just shows the top publishing countries, and it just unfortunately doesn't show all the countries, but the next one will, and it just shows the outputs produced over the period that we were looking at, and it sort of looks at the UK's publication record compared to the world's. There's more detail on this, and I can pass the slides around so you can see that. And so this shows the the productivity of the top 20 countries in our list, and
This is terrible. I'm sorry.
No, that's okay. Go for it.
It's really frustrating.
Why?
I'll tell you later, but I don't want to interrupt you.
No, that's okay. Okay.
Language is really a big barrier.
Yes. The analysis found that the UK is the most specialised in adult social care research, but was the second largest producer of publications after the US. And so that sort of just gives this where countries are in different areas. I'll come back to the lessons in a second, actually. So we also looked at economic returns work. So we have work underway to scope the feasibility of estimating the economic returns from investing in social care research. This follows work that RAND Europe have done on health returns, and they say themselves that it had a lot of assumptions and it had a lot of caveats, but the 39% return that they found is something that the Treasury in the UK have used time and time again. So they put together a methodology which looked at if you invest £1 in research, how much you get back, and they found that it was 39% return on the investment made. So we are carrying out initial scoping to see if it's possible to do the same for social care and long-term care within that, and which is due to complete at the end of this year, and then we will see whether it's possible to use the method for a fuller evaluation. So in order to do economic returns analysis, there's 4 lots of data that need to be collected. One is how much was spent on the research, on social care research, what the health or social care gain is, how much spillover that there is, and the spillover is things like employment of researchers, infrastructure, investment, and how long it takes to have that impact. We've developed 3 case studies to feed into the scoping work, and as a result of those 3 case studies, it's personally I found it's difficult to know what caused the impact, whether the research had any impact or whether it was everything else around it, whether having the research made any difference or whether it was just there and it wasn't even looked at, and how long the impact takes. For the work that RAND Europe did on health, they found it takes 17 years from finishing your study to having had an impact. But with the 3 case studies that we had, one was looking at AIDS and adaptations, and another looked at personal budgets. It was really difficult to see where the impact started, where the research finished and the impact started, and even whether there was any link to anything. And it also depended on the type of study. Where advocacy groups were involved, there was more immediate impact. Where there was lots of knowledge exchange activities, thank you, thank God for that. Where there was lots of knowledge exchange activities taking place, it was, there seemed to be more impact the more involved and more collaborative the project was. But it's still very difficult to pin down to, did this research have any impact, any positive impact. Other activities we're trying to work on in terms of research impact are a wider database of impact case studies on social care research. We're developing, there's an impact finder toolkit, which is a questionnaire survey, which is an annual assessment that you can carry out yourself, or universities tend to use, on impact from a particular project or for a particular researcher, and we're trying to adapt this currently for social care research. We're also doing a bit more work on what knowledge is used, knowledge broadly, not necessarily on research evidence, but anything else, practitioner evidence, user care knowledge, is used by decision makers to understand if and how research evidence plays a role, and we're also working on a toolkit for impact, which George mentioned too. Lessons, I don't know if we have any, partly because it's a bit early and partly because it's really hard to assess the impact. And as a funder, the School for Social Care Research really does need to, it's something we have to report to our funder, and there's always a very big section, what impact have you had on practice? We always start it going, it's too early to have had any impact, and then we have pages left to write things in. But it's trying to work out where your research had impact, how it had impact. That's really difficult, and partly that's because people don't seem to keep records, and researchers don't seem to keep records or logs where you've mentioned something to a minister that you happen to bump into or met on a train or something. And because there isn't that information, it's really hard for us to go back and find out. For one of the case studies, we were trying to find out how a particular grant in the UK, the Disabled Facilities Grant, was introduced in the 1970s or 80s, and it's taken us a very long time and asked lots of people, and we still don't know why it was introduced. And it looks like it was advocacy, but it could have been research, and just trying to pinpoint that is very difficult when there just aren't records and people haven't kept records. The more we have found that the better knowledge exchange methodologies that are used, it increases the likelihood of impact, but it's a bit difficult to retrospectively look at impact when people weren't quite using those new methods. But we have found that more collaboration, engagement, and doing something other than just journal papers does increase impact. Can I stop now? I could just say the Bibliometrics excludes reports and practitioner evidence and the language issue. So when we wrote the report, Round Europe did the work for us and we worked on the report, we did raise some concerns about whether it would work for social care because it excludes a lot of evidence that isn't in journal papers for just as a starting point. I'm done.